Well, good morning, everyone. It really is a pleasure for me to introduce myself and to welcome you to our 32nd Annual Healthcare Conference. My name is Ian Williamson. I have the great privilege of serving as the Dean of the Paul Merage School of Business here at the University of California, Irvine. And welcome to the 2023 Healthcare Forecast Conference. As I mentioned, this is our 32nd year of doing this conference, and which is phenomenal. It's particularly fun for me to be doing this today because I started as the dean here in 2021, and I've done 2 conferences. This is my 3rd, but this is my first one in person. So everyone told me when I arrived, we have this fantastic conference that we do every year, and I was actually wondering if they were making that up because I never knew. So now it turns out we do this, so that's a good thing. This conference, you know, one of the reasons why it's happened for 32 years is I think it's become a forum and a community, really, to talk about some of the most pressing issues in healthcare and to really get great insight to guide the decision makers from all across the country. And I really would like to thank the Conference Planning Committee for all the hard work and all their assistance over the past year in pulling together this event. Thank you very much to Sarah Dash, President and CEO of Alliance for Health Policy, Murray Ross, Vice President and Director, Kaiser Permanente, Institute for Health Policy, Christoph Staminkis, Director, Market Analyst and Insight, California Healthcare Foundation, and David Malabon, Senior Portfolio Manager, Benestar Healthcare Investment Strategy, Blakely Finance. I would also like to thank our sponsors. Obviously, these events don't happen without the support of organizations, and really appreciate them getting behind us yet again to support this fantastic event. Now, I have to apologize. I'm a dean of a business school, and I can't stand in front of a group of individuals and not say a few kind things about my institution, so please indulge me. I'm very honored to be the 12th dean of our business school. There have been 11 people who've had this job before me, and each of them have made tremendous contributions, so I certainly know I stand on the shoulders of giants. And we're part of the prestigious University of California system. We're part of the University of California, Irvine. We are a business school that is consistently ranked as one of the top 5% business schools globally. And we pride ourselves on being some pillars. One of those being that we're a business school focused around technology, and that we believe that fundamentally as we think about the challenges of our communities, that technology plays a central role in that. And as a result, we want to be a place that trains leaders to think about technology, business, and entrepreneurship, and how those 3 things come together. We also are a business school that believes very firmly in inclusive excellence, that we want to be a platform that ensures that all members of all communities are able to thrive in the space of business. And we see those 2 things of inclusive excellence and technology really coming together in many different industries, particularly health. And so we have quite a bit of activity in this space and have so for many, many years. We have a phenomenal undergraduate program at our business school. It is ranked number 30 in the world, and this is really phenomenal given that the business school's undergraduate program is less than 15 years old. And so for us to have gone from that idea to this phenomenal group of students is really amazing. We pride ourselves, again, on having a group of students that are really truly representative of all of our communities. We have 22% of our students come from traditionally underrepresented groups. 31% of our students are first in family in terms of going to college. I should say, you know, what's amazing about our mission is we truly are getting the best and the brightest from all the possible communities we can have across California and providing an environment for them to excel. And it's very rewarding for me to be a part of an institution that has it as its mission. We also have a very vibrant master's program. We offer masters in business analytics, accountancy, finance, innovation, and entrepreneurship. We also have a very prestigious MBA degree. And I should note in that MBA degree, we have a healthcare track. And many of our alums from our healthcare MBA are in this room today. And I see them pumping their fists, and that's excellent. And so I know, having had a chance now to meet a lot of those individuals, including interviewing one of them last night, for those of you who are at the reception, Dr. Ramos, just to see the impact those individuals have had in the healthcare space has been phenomenal. The other thing that I just want to highlight is, in addition to our degree programs, we believe that the education that we provide should be accessible. And while certainly it's great that we have our degree programs, it's not the case that everyone is going to come back and get a degree, a master's degree or undergraduate degree as a retool. And so we've launched last year our Leadership Development Institute. And this is an institute that we have within our school, which is designed to create customized offerings to meet the needs, the educational needs of professionals. And it really works with organizations to identify the specific skill sets that are necessary to upskill a workforce, to provide them with understanding around new emerging technologies, and then more importantly, to provide them with the leadership capability to execute on those technologies. That institute has made a particular focus on the healthcare space. Last year, we launched a Chief Nursing Officer program. We are in the process of launching a Chief Medical Officer program. And these are all programs designed to provide expertise to those individuals, those professionals in the field who are dealing with the radical changes that we're going to hear a lot about, the dynamic environment of the healthcare space, and ensuring that they're equipped with the right tools to lead their organizations going forward. So I'm excited about what we're doing in the business school. I'm particularly excited about what we're doing in the business school in the space of health. It is obviously a very important industry for us here in Orange County, and clearly one of the most important institutions we have in our communities. So I commend everyone here who's in that space. Thank you for all the work that you're doing to keep us healthy. And I do hope that this conference gives you insights, skill sets, and perhaps relationships that will further your mission as a healthcare practitioner or individual involved in the health space. Now, I'm not a medical doctor, and so I think I've exhausted my level of expertise for this event. I've been able to get a group of people who can have a great gathering, but I do think it's important for me to maybe step out of the way and actually bring on the true healthcare professionals. And I can't think of a better person to come up next to sort of get us launched into that space than Dr. Steve Goldstein, who is a colleague of mine here at the university. I should probably give a little bit of background. He's the Vice Chancellor for Health Affairs, Distinguished Professor of Pediatrics, Physiology and Biophysics, and Pharmaceutical Sciences. He is nationally renowned scientist, pediatric cardiologist, and academic administrator. As Vice Chancellor for Health Affairs at UCI, he oversees the Susan and Henry Samueli College of Health Sciences, UCI Health, the Healthcare Delivery System, and the UCI Centers and Institutes of Health. So he's busy. He's got a lot on his plate. He is leading a major expansion rooted in a One Health vision, united across disciplines for whole person care based on data-driven precision health and the Discovery, Teach, Heal mission. I'm sure we'll talk a little bit about that, but I think it's truly a fantastic vision for how we've organized our health activities here at the university. He holds an MD and a PhD from Harvard University, has been a senior leader at Yale University, Brandeis University, and the University of Chicago, served as an advisor to the National Institute of Health, National Science Foundation, and not-for-profits committed to health, and is a recipient of numerous honors. We are very, very fortunate to have Dr. Goldstein here on campus leading our health space. It's great that I have a chance to work with him as a colleague. And Steve, would love to have you come up and speak to the group today.
It is a pleasure to see you all today. You should cut any sort. We can cut that in half when you introduce it. Welcome to UCI. It is a pleasure to have you here today. Thank you, Dean Williamson, for this incredible meeting. It's such a valuable meeting. Great minds with varied expertise and perspectives. And we're here together as a convergence of health innovation and business creativity to consider important topics. Perhaps COVID made it more apparent to others, but those in this room have long known that the same American healthcare system that's advancing the frontiers of complex care is failing to provide services equitably, and there has been inadequate attention to disease prevention. Even before the pandemic, America sat at the bottom of lists for child and maternal mortality and morbidity among the developed nations. We have work to do, and we have the expertise to change how we do it. You can be the solution. Innovation in health services and business can improve access, quality, and equity. Doing so is in keeping with UC Irvine's priorities. We are the only academic health system in Orange County, a diverse region, which is the 6th largest in the United States. By providing safety net services and tertiary and quaternary advanced care, it allows us to support 100 regional hospitals. Moreover, the unique approach that we bring, that Dean Williamson mentioned, is a structure that we call One Health. The idea behind this is to create a future state of healthcare that we all desire. One Health describes a silos-free alliance of health disciplines and allied health professionals. For us, that's our schools of medicine, nursing, pharmacy and pharmaceutical sciences, public health, the institute, the Integrative Health Institute, all working together to produce team-based care. The purpose is ultimately to produce a future where care is delivered by diverse teams of providers who reflect the communities that they're serving. The care should be patient-centered, whole person, data-driven, and team-based, so that professionals are working at the tops of their licenses with the patient at the center of care. We pursue this behind the Discover, Teach, Heal mission that Dean Williamson mentioned. This is a virtuous cycle. It means that what we do in the hospital today teaches us what we must investigate and teach so that what we do tomorrow is even better. A continuous quality improvement strategy for a learning health system. In our case this year, our focus is on interprofessionalism. And there are 4 ways that we are advancing that right now. The first is in education, programs that bring students across health disciplines together to learn to be providers that work in teams. We know this leads to efficiencies, better communication, and better patient outcomes. Interprofessionalism in discovery. We are clearing the ground a few hundred yards away for a 220,000 square foot Falling Leaves Foundation Medical Innovation Building, which will be opened in 2025 and populated by interdisciplinary teams to move basic discoveries into translation. We are focused on interprofessionalism in whole person care. In the fall, we opened the center on campus for the Susan Samueli Integrative Health Institute, where we are pushing forward whole person care across the nation through research, teaching, and care. And we are pushing forward interprofessional access. And we are doing that through expanding our Orange campus, which is 12 miles away, and a mile from here, building a new medical complex, UCI Health Irvine, sorry. That's gonna be an ambulatory care, an emergency department, an expansion of the cancer center, ambulatory surgery center, and a new hospital, all up on Jamboree. And all of this is underpinned by data, its use, machine learning, AI, and algorithms. That approach is fostered by the institute we opened last year for precision health. And it is one of the most important ways, I believe, and you can see it up there, digitally driven world, that we will change practice, bend the cost curve, improve equity, and change policy. So as a university committed to the American dream, we convene with the innovators in this room and those on Zoom, because you can create this future where healthcare is accessible and affordable and equitable in our own communities, and then others can do it far beyond. So I ask you to please make it so, like they say on Star Trek. And I thank you for attending this conference. And now I'm going to introduce Sarah Dash to you. So Sarah is the President and Chief Executive Officer at the Alliance for Health Policy. She joined the Alliance in 2014 as the Vice President for Policy and became the President and CEO in May of 2017. Sarah has long been influential in shaping health policy, having served as a senior aide on Capitol Hill, as a member of the research faculty at Georgetown University Health Policy Institute's Center on Health Insurance Reforms. And in addition, that her background is that she holds a master's degree in public health from the Yale School of Public Health and an SB from MIT, which I understand is a BS for the rest of us, but MIT is a special place. Sarah also holds an executive certificate in nonprofit management from Georgetown University. Sarah Dash, please.
Wow, well, thank you so much for that warm introduction. Thank you, Dr. Goldstein. Thank you, Dean Williamson, and thank you to the UC Irvine Merage School of Business for hosting this incredible event. It's an absolute honor to be here with all of you today. And congratulations on your 32nd conference. You know, I couldn't help but notice it's February 23rd, 2023. And it's the 32nd year, so I don't know if you guys did that on purpose, but well done, well done. I'd be remiss not to thank the fellow members of the steering committee, Murray Ross, Christoph Stermicus, David Mandelbaum, who is a fellow with the Alliance, couldn't be here today, and thanks to Diane Ford. It's really been a pleasure. So as Dr. Goldstein mentioned, I'm the president and CEO of the Alliance for Health Policy. And just to say a quick word about who we are, we just celebrated our 30th anniversary. We are a nonprofit, nonpartisan organization. We're really dedicated to advancing knowledge and understanding of health policy, mainly with the health policy community in DC. And you're going to hear from some of the most illustrious and best thinkers in that field today. I'm so thrilled to have so many of my friends from the DC health policy community here today. By the way, for those of you who came for great discussion, great dialogue, it's going to be a great day. For those of you who came because it was going to be a couple days in sunny California, welcome to Maryland. So, yes. But what I will say is that our goal on the planning committee was to bring the best of federal and state health policy thinking to you here in the audience, you who are doing the hard work day in and day out of really making healthcare happen in your various fields. And, you know, something we've learned over 30 years at the Alliance is, you know, information alone is not enough. Education alone is not enough. The reality is that healthcare policy nationally has always, for a number of reasons, been a very challenging discussion and dialogue. We know we sit in a reality that's divided in a number of ways, whether it be partisanship, whether it be different incentives or perspectives of different industry stakeholders, right? And what often gets forgotten, as Dr. Goldstein so eloquently reminded us, is the patient, right? The person, bringing that person to the center. And so what we have learned at the Alliance is that information alone is not enough. It's how we speak with one another. It's the quality of our dialogue. It's how we learn to communicate. And I think we're still at the forefront of that, just like you're at the forefront here at Irvine of figuring out how to create interdisciplinary and team-based care. So our theme today is learning from unfinished business and leaning into the future. And we were very deliberate there because we said, well, what happens when you bring a group of people together after several years of being apart? What has happened over the last 3 years is, an indelible mark on our history, right? And we need to learn from the past. And we do have unfinished business in the wake of this historic pandemic, right? Of shoring up our public health system, of pursuing racial equity in health, improving access to care, all of those pieces. And at the same time, we have these incredibly future-focused needs that we're going to also talk about today, right? Healthcare is changing, healthcare is dynamic. We're going to talk about what does a digitally driven future look like? How do we wisely harness health technology while dealing with all of the trade-offs that are inherent in that? And in this week when we have celebrated President's Day, it's kind of hard to believe it's already almost the end of February here, folks, but I was reminded by my team that our very first president, George Washington, was well aware of the value of the same public health tools, some of them that we still use today, including inoculations. He required all his revolutionary troops to be inoculated against smallpox, I learned. He also utilized other public health tenets like hand washing and good sanitation. So he kind of understood that, right? Like that is what we need to build a strong nation. And so I am looking forward to learning from the past, learning what we have learned over the last few years, talking about how we emerge stronger and how we lean into the future. And we have amazing speakers, really, truly, to bring you through our agenda today, which I will just quickly preview before I get off of the stage and turn it over to them. We have two forecast panels. This is the Healthcare Forecast Conference. So we decided that we needed, there was just so much to cover that the first panel would be focused on policy, and the second forecast panel on understanding today's healthcare markets. We'll have a lunchtime keynote from my dear friend and colleague, KP Yalpella, who is going to talk about the unfinished business and future-focused needs around health equity. And then we will bring you three panels that we've sort of dubbed as problem-solving panels, right? The idea of bringing that federal and state policy perspective to the unfinished business that you, as healthcare executives and operators, are working on every day. So with that, without further ado, who is ready for a great conference today? Yeah, thank you, yay. Amazing. All right. So please join me in welcoming the moderator for our first panel, Murray Ross, who is a member of our planning committee. He was kind enough to volunteer to jump in as a substitute for Julie Rovner, who was on your agenda. Unfortunately, she was unable to attend due to a health emergency, but we are wishing her well. And we are so thrilled to have Murray with us. Dr. Ross currently serves as the Vice President and Director of the Institute for Health Policy at Kaiser Permanente. Prior to Kaiser, he is a trained economist, and he served as the Executive Director of the Medicare Payment Advisory Commission. I don't usually have to say that out, like spell it out. MedPAC, many of you know, and spent 10 years at the Congressional Budget Office, lovingly known as the CBO, leading the team that scores proposed health legislation during the last few years of his tenure. So Murray, take it away. Thanks, everyone.